Oncology is the study or treatment of cancer, in particular the prevention, diagnosis, as well as treatment. However, we are also with Dr. Bahall, who is a gynae oncologist. Already when you think about cancer, some of the popular ones you may think about is breast cancer, lung cancer, cancer of the cervix. Did I leave out any?
Colorectal cancer, prostate cancer.
Yes.
So those are sort of the top 5 cancers when you think of cancer, especially in the world and the Caribbean. It would be colorectal, prostate, breast, cervical cancer, and lung cancer.
Yes. But before we go on, there's a lot of viewers who may not understand exactly what is cancer. So if we can break it down in layman's term to explain the cell and how the cell is supposed to multiply, and then when cell dies, and how does this cell formation now turn into a cancer or tumor?
Right. So generally in our bodies, in every one of us, we have cells that replicate.
Yes.
So when cells die, they undergo what you call, the medical term is apoptosis. But basically, simply put, there is cell death.
And then new cells are formed.
And then new cells are formed.
Yes.
And sometimes, as we get older, that's one risk factor. When we get older, and people are living longer now because we have more advanced treatment for other chronic illnesses. So as patients live longer, there is the higher chance or probability that when cell death occurs and these new cells replicate, you could now have abnormal cells being formed. And this one abnormal cell, when it's formed, and that's because either of age or they can have other risk factors, which you will talk about later on, and once you have that abnormal cell being formed, that then replicates. And it goes from one cell and it can double and double and double, and pretty soon you have an abnormal growth.
So it's basically uncontrollable.
Yes, and once that happens, a lot of times when it's developing early on, patients don't know, men and women don't know because they don't have any symptoms when it's very early on. But when this growth becomes a certain size, from being microscopic to a certain size where you can see, that's the time when some of these symptoms can present.
Yes.
And the symptoms depend obviously on the type of cancer we're dealing with.
Yes.
Whether it's lung cancer, whether it's prostate, breast, or even gynae cancers like cancer of the womb or cervix.
Yes. There are a lot of persons who may hear certain jargons and may not understand these jargons. For example, benign as opposed to malignant. And we would understand that the malignant will be cancerous in terms of that these cells, they spread, but they can also, what's the difference? In your professional opinion, they say that the both of them, they have the possibility or the propensity to grow, but it's only the malignant cancer cells that would spread. Is that true?
Yes, it is true in that. So sometimes when patients hear the word tumor, they think, well,
immediately
it's cancerous.
Cancer, yes.
But tumors can be benign or malignant. So a lot of times in the clinic, I would use the word cancer, and if I use the word cancer, then you know that's a malignant type of tumor.
Yes.
And I would try to avoid saying the word tumor when you're dealing with benign. So I would say, look, this is a non-cancerous growth.
Or just a mass.
Or a mass.
Yes.
So sometimes, because when a patient comes to me and they have a growth, once you mention the word tumor, they automatically think cancer, because you're already in that state where you're unwell, you have this growth, and a lot of times you're confused after you forget. So I tend to try to be very, very clear whether it's benign, meaning non-cancer growth, or cancerous type growth.
Yes. I'm looking to address the layperson that may be watching us right now and sometimes not understanding what is their next step. For example, you may have just been diagnosed and then you're wondering, I need a doctor, but what type of doctor? Just to differentiate between an oncologist and a gynae oncologist who will deal more with the reproductive organ, for example, like the cancer, vulvar cancer, vaginal cancer, cervix cancer. And then there are ladies who may not understand what is the difference between the vulva as opposed to the vagina. These are things that sometimes professionals may take for granted, but in the world outside of medicine, these terms may be a bit confusing for the lay person.
Agreed. So just starting off on the difference between an oncologist and a gynae oncologist. So an oncologist Even oncology, you have medical oncologists and
Yes.
clinical oncologists. So simply put, a medical oncologist deals with chemotherapy treatments. So a lot of patients who have a cancer, they may have to undergo a combination of treatments, and it's given by different sets of doctors. So the medical oncologist gives chemotherapy, a clinical oncologist gives radiotherapy, a gynae oncologist is involved in the surgical aspect of treatment. So we have special training to do additional or more advanced procedures for these types of cancers, where you would talk about cancer of the ovary, cancer of the womb, cancer of the cervix, vaginal and vulvar cancer. And because of our training, because it requires much more advanced surgery, extensive surgery, and we would deal with that. But we not only the actual surgery, but in coordinating the care. Because when a woman has a cancer, or man, but if I'm talking about gynae cancers, when a woman has a cancer, it involves myself, it involves the medical oncologist, the clinical oncologist, the radiologist, because the radiologist is the doctor that specializes in the CT scans and MRIs and will read all these imaging and help stage the cancer. It involves the pathologist, that's the doctor who reads these biopsies and would give us a diagnosis of what type of cancer and help guide treatment. So it not only involves one person, it's what you call a multidisciplinary approach, where you have multiple disciplines in medicine and they all come together to treat this one patient. And just to give you an example, every single patient who has a cancer, we have meetings every month, sometimes every 2 weeks, where we discuss each patient, and this meeting involves all these different specialties. So all of these consultants or senior doctors would come together to discuss what's the best way forward for this patient, because sometimes it's not as straightforward as just doing surgery, or not as straightforward as just giving chemotherapy or radiotherapy. It involves different sort of treatment.
So doctor, a lot of women who are watching this program now, you would advocate that we take a more preventative approach, preventative care, because as you said earlier, cervical cancer can be prevented. What steps would you advocate strongly that women should take?
Well, simply put, there's a vaccine available, which is given from age 9 to 13. It's available at the health centers as well as hospitals and private doctors, and this is the HPV vaccine.
Can I interject 1 minute? Because there are viewers who may be watching and wondering, is this really an antidote, or how safe are these vaccines really?
So the vaccine is very safe, and I advocate it because, one, you have to be aware that the HPV vaccine, there is no HPV in the vaccine. There is no HPV virus in it. Secondly,
but to have an antidote, there need to be some element or trace of that virus, yes?
Yes, agreed. So they are what you call virus-like particles, so there's no active virus, and it's similar to what you would have in vaccines that we give to children and babies, where you have no live viruses in some of these vaccines, and they could now create a vaccine. And this has been given, or has been given for the past 20-30 years in other countries like Australia and the UK, and they're on their way to eradicating this condition as well. Other preventative measure would be pap smears, and that should be done from age 21 straight up until age 65, and it's usually done every 3 years. And if you visit your doctor, they can sort of advise you for on a tailored approach to yourself based on your history. The other lifestyle change I would recommend is smoking. You need to stop smoking. Smoking increases your chance of getting these types of cancers as well.
Yes. Thank you very much, doctor.
No problem, pleasure.